A 45-year-old walks into my office feeling completely fine, tired maybe, thirsty all the time. He laughed it off as just getting older. 6 weeks later, he's in the ER with a blood sugar so high it nearly shut down his kidneys. 1 in 8 Americans has diabetes right now. More than 1 in 4 of them have no idea. By the end of this video, you're going to know exactly how this disease sneaks up on you, what to do if it's already happening to you, and the 5 things you can start doing this week to keep it from happening at all. Here's the simplest way to think about it. Every time you eat, your blood sugar, that's the glucose floating in your bloodstream, goes up. Your pancreas releases insulin, which is basically the key that unlocks your cells so that glucose can get inside and get used for energy. Diabetes happens one of 2 ways. Either your pancreas stops making enough of that key, that's type 1, or your cells stop responding to the key even when it's there, which is called insulin resistance, and that's type 2. Think of insulin resistance like a lock that's been jammed so many times the key barely turns anymore. The glucose backs up in your bloodstream instead of getting into your cells, and over years, that excess sugar quietly damages your blood vessels, your nerves, your eyes, your kidneys. Type 2 makes up roughly 90 to 95% of every diabetes case in this country. This is the one we're talking about today. If you're over 45, if diabetes runs in your family, if you carry extra weight around your midsection, or if you've been told your blood pressure or cholesterol is borderline, you are statistically in the highest risk group walking around in America today. Genetics load the gun, but lifestyle pulls the trigger. Years of a diet high in refined carbs and sugar, combined with a body that doesn't move much, slowly wear down your cells' ability to respond to insulin. Certain groups, Black, Hispanic, Native American, and Asian American adults, carry a higher genetic risk and are diagnosed more often. Women who had gestational diabetes during pregnancy are also at significantly higher long-term risk, even if their blood sugar went back to normal after delivery. None of this is about blame. It's about knowing where you actually stand. Let's get specific, because eat healthy has never helped anyone. 1. Swap your breakfast carb. If you're eating a bagel or sugary cereal every morning, that's a glucose spike before 8 a.m., swap it for eggs or oats with nuts and berries instead. 2. Walk for 10 minutes after your biggest meal, just 10 minutes. Post-meal movement pulls glucose out of your bloodstream and into your muscles without needing extra insulin at all. 3. Get your waist measurement, not just your weight. Over 40 inches for men, over 35 for women is the number that actually correlates with insulin resistance. 4. Strength train twice a week. Muscle tissue is one of the biggest glucose sponges in your body. The more you have, the more forgiving your metabolism becomes. 5. Get an A1C blood test if you haven't in the last 3 years, especially if you're over 35. This one test catches what symptoms hide for years. If you or someone near you has diabetes and is experiencing extreme confusion, fruity smelling breath, vomiting, rapid breathing, or has lost consciousness, call 911 or get to an emergency room immediately. That can be diabetic ketoacidosis, and it is life-threatening. Do not wait it out. If someone is shaky, sweating, confused, or about to pass out and you know they take insulin, that's likely a low blood sugar emergency. First, give them fast sugar, juice, regular soda, glucose tablets, not diet anything. Second, wait 15 minutes and recheck if you can. Third, if they don't improve or they lose consciousness, that becomes a 911 situation too. Don't try to manage it alone. These are the 2 scenarios where minutes matter. Everything else in this video, you have time to think through. This does not. For most people newly diagnosed with type 2, the first step is lifestyle change, diet and movement paired, often with a medication called metformin, which helps your liver release less glucose and helps your cells respond better to insulin. If that's not enough on its own, your doctor may add other categories, things like SGLT2 inhibitors, GLP-1 receptor agonists, or eventually insulin therapy itself, depending on how your body responds over time. I'm giving you drug classes here, not doses, because your exact treatment depends on your kidney function, your other health conditions, and your own blood sugar patterns. This video can teach you the landscape. It cannot replace the doctor who actually has your labs in front of them. That part has to stay between you and them. Eat more of these steel-cut oats because the fiber slows glucose absorption instead of spiking it. Fatty fish like salmon because the omega-3s actually improve how your cells respond to insulin. Leafy greens like spinach and kale, almost zero impact on blood sugar, packed with the magnesium your cells need for that insulin lock to work properly. Berries instead of tropical fruit, lower sugar load, same satisfaction. Avoid white rice and white bread. They break down into glucose almost as fast as table sugar. Avoid fruit juice, even the 100% natural kind, without the fiber from whole fruit. It's a sugar bomb. And watch flavored yogurts. Many have more added sugar per serving than a candy bar. Stop drinking soda or sweetened coffee drinks daily. That habit alone can double your risk over a decade. Stop sitting for more than 2 hours at a stretch without standing up. Prolonged sitting independently worsens insulin resistance, even if you exercise later that same day. And stop skipping sleep. Less than 6 hours a night measurably raises your blood sugar the very next morning, regardless of what you eat. Vinegar before a carb-heavy meal can blunt the glucose spike that follows. Cinnamon won't cure diabetes, but it has mild, real evidence for improving insulin sensitivity. It's not nothing. The order you eat matters. Vegetables and protein first, carbs last, flattens your blood sugar curve significantly. Stress raises blood sugar even without eating anything. Cortisol pushes glucose into your blood directly. And the single biggest predictor of reversing prediabetes isn't a supplement. It's consistent weight loss of even 5 to 7% of your body weight. If there's one thing I want you to walk away with, diabetes doesn't announce itself loudly. It whispers for years before it shouts. Listen for the whisper.